everyone. Welcome to our special live program on Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. So today, before we welcome, today our exciting session will be on cancer immunotherapy awareness. As many of them would know, or this June month is known as for Cancer Immunotherapy Awareness Month. So before we get down to know what exactly is cancer immunotherapy and why this awareness is celebrated, let me take an opportunity to introduce Dr. Krishnamani, our esteemed guest speaker for our today's live session. Dr. Krishnamani has more than 10 years of experience in the field of medical oncology, expertise in treating different types of cancer with latest medical technology or oncology in the field of oncology. Dr. Krishnamani is associated with American Oncology of Institute, Hyderabad. So let's join me in welcoming Dr. Krishnamani. Thank you, Doctor. Welcome to this live session on cancer immunotherapy awareness.
Hello and welcome to Cancer Reach. Thank you for the introduction. Cancer Reach is an initiative to spread awareness about cancer. And as you rightly said, June is the Immunotherapy Awareness Month. So today we thought we will discuss something on immunotherapy. What is immunotherapy? Where do we use it, etc. So that is what this whole session is going to be about.
Actually, sir, the topic itself is so exciting when cancer immunotherapy awareness. I guess many of the people won't exactly understand what exactly is. So before we start, doctor, can you just brief what exactly is immunotherapy or cancer immunotherapy?
So when we talk about cancer, the word which first comes to the mind is chemotherapy.
Yes.
Right? So when you say chemotherapy, there is a fear in the general public's mind that it is dangerous, you'll lose hair, you'll become dark in color, you'll lose weight, you will not be able to
Yes.
eat, vomiting, etc. So what is chemotherapy is first what we should understand. Then we will go to immunotherapy because that is the history of cancer treatment.
Okay.
So chemotherapy is a drug which kills or controls the cancer.
Yes.
Okay. Like an antibiotic is used for bacterial infection, chemotherapy means for cancer, it either kills the cancer cell or controls the cancer cell.
Okay.
But in the bargain, it also kills the normal cells. So you lose hair, you lose taste, okay? The sperm count may decrease. Women may stop having periods after few sessions of chemotherapy, okay? Ovary function declines. There can be nausea, vomiting, weakness, fall in WBC count, fall in hemoglobin, infections, fall in platelet counts and all that.
Yes.
Because chemotherapy kills the cancerous cell and other normal cells also. So there have been wonderful benefits and gains due to chemotherapy in the last so many years, but there have been early side effects and very, very late side effects also. And patients do undergo problems or side effects during chemotherapy. So, and also what we have to understand is chemotherapy doesn't work in all cancers, or some cancers keep coming back. So this has prompted researchers to work whether there is something else. And that is when we found immunotherapy. So chemotherapy has been there, is still there, is kind of the backbone of medical oncology. But because of its adverse events, we have thought, do we have anything which doesn't have the chemotherapy side effects? Because the disease comes back in many other people and then chemotherapy is not useful, then are there any diseases where we cannot avoid chemo and give immunotherapy? That is how immunotherapy, the recent trend for immunotherapy started. So you are trying to move away from one form of treatment to another form of treatment, or trying another form, not even move away. That is there. This is also there. Right. Now, this immunotherapy it boosts your immunity to kill the cancer cell.
Okay.
So that is how it differs from chemotherapy.
Okay.
Yeah.
So, in short, doctor, we can say that immunotherapy is a latest technology in the cancer treatment, like that we can claim it.
So if you go back to the history of immunotherapy, in 1900s itself,
Hmm.
There have been paper articles in New York Times that
Oh.
a gentleman, a physician by name Coley, Coley, had
Hmm.
used bacterial germs to kill cancer. So
Oh,
that is what they say is one of the first breakthroughs in immunotherapy in the world. That is almost 125 years back.
okay.
So it is not latest. We have had a lot of recent interest in immunotherapy because of the reasons I told you.
Yes. Side
And
effect.
a lot of research has happened in the last 20 years. Because of it, there is a sudden burst of immunotherapy.
Okay.
But
So the usage has increased more.
increased, some new research has propelled the usage.
Hmm.
But if you say it is just 15 years old, no, it is more than 125, 150 years old. William Coley had used it way back. Then there have been other scientists, Paul Ehrlich, they say,
Hmm.
he has used. So these were all the early experiments of using toxins to kill cancer cells. When they gave the toxins, the body immunity to react to the toxin
Hmm.
indirectly also killed the cancer cell. So that is a form of cancer immunotherapy.
So it is a trick that the patient's own body can kill the cancer which is
It is
born
boosting
within the.
your immunity to kill the cancer.
Um,
That is immunotherapy. So what happens in the bargain is doesn't kill every cell. It doesn't kill every cell like a chemotherapy. It has its own side effects, which we will come to, but it
okay.
doesn't kill like chemotherapy. You will like hair loss, nausea,
Hmm.
vomiting. Those drastic side effects are not going to be there.
Okay, okay. Sir, you were referring something regarding that Kohli and many other. Can you little bit brief more on history in immunotherapy?
As I told you, very early in 1900s, so 20th century, to kill certain types of cancer. It was reported in the newspaper that almost 150 patients of cancer have been cured by the erysipelas toxin,
Okay.
which is a bacterial toxin.
Oh,
It,
okay.
that work was further taken forward by other people, and few people were awarded the Nobel Prize. As late as 2018, the pioneers in immunotherapy, James Allison and Tasuku,
Hmm.
both were awarded the Nobel Prize for their groundbreaking work on immunotherapy. Then that is 2018. If you
Hmm.
go back in time a bit, maybe 60s and 70s, interleukins and interferons came into the picture.
Hmm. Hmm. Hmm.
BCG vaccine, which is there, is a form of
Hmm.
immunotherapy because it is used to kill very early bladder cancer. So your BCG vaccine, which is nothing but the TB bacilli, the
Hmm.
TB bacilli is instilled into the human bladder, urinary bladder, in very early
Hmm.
stage bladder cancer to
Hmm.
prevent recurrence. So that's a form of immunotherapy. Interleukins, interferons. And
Oh,
then
okay.
came the new immunotherapies, which are your PD-1 blockers, PD-L1 blockers,
Hmm.
etc., etc. So the history is almost 125, 130 year old.
Hmm.
But recently there has been a lot of rekindling of interest.
Okay. So it is just as you mentioned the side effects to take care of the chemotherapy side effects. I guess immunotherapy is much more used in nowadays trend, or it is
No, it is because we have now research has told us that in certain diseases, immunotherapy is the best, like kidney cancer. Chemo we don't use.
okay.
In some proportions of lung cancer, skin cancer, melanoma,
Oh,
you don't use chemotherapy. You go for immunotherapy only.
okay. So, oh, sorry, doctor.
It is not that you want to avoid chemo and you're going for immuno. It came up because of a lot of factors. Some of these are the factors which we discussed.
So, doctor, like you were saying, like lung cancer or kidney cancer, can you elaborate in which cancers we can use this immunotherapy?
So right now you have a list of cancers. Like every week there's a new cancer added, new indication added.
Oh,
Melanoma, skin cancer. Go for lung cancer. Go for kidney cancer. Go for foot pipe, esophagus. Go for stomach cancer.
hmm,
Urinary bladder cancer. Gallbladder cancer. Yeah. So the list of cancers for which immunotherapy is small cell lung cancer, non-small cell lung cancer. So the list of cancers for which triple negative breast cancer. See, each time
hmm,
I'm trying to say something, I'm getting I'm just trying to recollect which are the so breast, lung, kidney, skin, GI, urinary bladder, gallbladder. So the list is endless. And every day a new indication is being added. Before surgery, after surgery, stage 4 setting, early setting. So earlier we used to do it in stage 4. Then people realized, why don't you use it early stage? Early stage is after surgery. Then people started using before surgery,
Oh.
after radiation. So now
Hmm.
immunotherapy is used in all kinds of scenarios and in many types of cancer.
Oh. So it's like, in fact, doctor, first of all, so many cancers now listening, these all new are topics like newly listened cancer, whatever you have highlighted now. Because we are very much aware of breast cancer, but triple negative breast cancer. Oh my God.
That's a variety of breast cancer which is very aggressive, where chemotherapies have conventionally not worked.
Oh.
So they have advice. So now immunotherapy is there in the stage 4 setting, in
Hmm.
the early setting before
Okay.
surgery. So immunotherapy is advised in a variety of breast cancer called triple negative, which is very aggressive.
Sir, in short, like immunotherapy can work in different stages of cancer, like even initial stage, and also it can take care in the fourth or
Most
final stage.
95% of the times when you use immunotherapy, you use it in advanced cancer, that is stage 4.
Okay.
But yes, in lung cancer stage 3, we use immunotherapy after radiation.
Hmm.
Okay.
Okay.
So there are, what do you say, examples of that. But by and large, most of the time when you use immunotherapy is in the advanced stage.
Okay. Doctor, now actually, while discussing this immunotherapy and chemotherapy, can you little bit brief more exactly what is the difference between chemotherapy and immunotherapy?
So chemotherapy is a agent which kills cancer cell and normal cells.
Yes. Hmm.
Immunotherapy kills or controls the cancer cell. Chemotherapy
Hmm.
is a cytotoxic drug.
Hmm.
Immunotherapy improves your immunity to kill the cancer. Chemotherapy has fixed side effects like nausea, vomiting, weakness,
Hmm.
loss of taste, hemoglobin fall, WBC platelet.
Yes.
Immunotherapy doesn't have these side effects, but the common side effects are weakness and hormonal issues. It can affect your thyroid, it can affect your lung, it can cause
Hmm.
interstitial lung disease, we say. It can cause liver issues, it can cause skin dermatitis, it can cause a diarrhea, which is called colitis. So inflammation, we say itis, inflammation.
Okay. Hmm.
Immunotherapy boosts your immunity to such an extent that your immunity becomes hyper. So you
Oh.
can get thyroiditis, you can get pancreatitis, liver called transaminitis, you can get lung disease, interstitial lung disease or pneumonitis, you can get dermatitis in the skin, you can get colitis. So that's a completely different set of side effects.
Hmm.
Hmm. Chemotherapy can be given orally, IV, IM. Most of the time, immunotherapy is given IV, intravenous right now.
Okay.
Chemotherapies are far cheaper. Immunotherapies are extremely expensive generally.
Oh, okay.
Even in India where it is subsidized, but still for our population, it's definitely expensive. It can go up to 1 to 2 lakhs per cycle.
Oh, my God.
So this is broadly the difference between chemotherapy and immunotherapy.
So, like doctor, when you are highlighting the side effects of immunotherapy, that will again, it will differ from patient to patient.
Yes. One more difference is chemotherapy usually is given for a fixed number of cycles, 6 cycles.
Okay.
Immunotherapy also, if it works, is given for a fixed number of cycles, usually 2 years.
Oh.
Another difference is when you give chemotherapy after 3 or 4 cycles, you do a CT scan or a PET scan.
Hmm.
If the disease increases, it is usually called progression.
Hmm.
In immunotherapy, after the first 4 or 5 cycles, if you do CT scan, if the disease increases, there is something called pseudo progression. Sometimes the disease may look it has increased on the scan, but the patient is fine in the initial months after immunotherapy. So they
Oh,
say repeat the scan after 4 or 5 cycles, the disease will come down. Pseudo means false progression, it's a false
false prog.
alarm. So an increase while on chemotherapy is definitely an increase. But
Hmm.
an increase while on immunotherapy sometimes could be false increase. So be watchful.
Oh. So it is like confusing the situation for patients as well as a challenging
So
job for
that's
a
why we should
doctors.
have the idea of what is chemo and what is immunotherapy.
Hmm. So in short, doctor, chemo, you can say because it has a same effect, same thing, it is easy to predict. Immuno, different attacks, so prediction can be a little bit challenging for the doctors.
Chemo also prediction can be challenging. You never know which chemo will cause what kind of side effect. You can develop a heart attack because of chemotherapy. You can develop heart failure. You can develop pneumonitis. You can develop
Oh,
irreversible neuropathy. Nerves can be damaged.
oh.
So, but by and large, immunotherapy side effects are less than 5%. Otherwise, they are safe except for weakness or fatigue.
Hmm.
Immunotherapy side effects, and the side effects differ. It is all inflammation, itis, perioditis, dermatitis, colitis, pancreatitis, etc.
Oh my God. Doctor, is there any types in immunotherapy?
Immunotherapy types are based on, so basically what happens is you should understand the background of immunotherapy.
Hmm.
So what happens is uh, when there is an antigen in your body, which is a
Hmm.
foreign substance,
Yes.
there is a cell called antigen presenting cell
Hmm.
that takes it and keeps it like an antenna on its antenna.
Hmm.
Then nearby there are some T cells. T for Tamil Nadu. The T cells are inactive, but when the antigen presenting cell comes to it, the T cells become active.
Yes.
They attach to the antigen presenting cell and they
Hmm.
come in touch with the antigen, which is already
Hmm.
there on it, on the
Yes.
antenna. So the
Hmm.
inactive T cells become active.
Okay.
So they release some substances which kills the tumor.
Oh.
That is called tumor kill.
Hmm.
So tumor is sitting, your T cell is silently sitting, inactivated state. This APC comes, activates the T cell by attaching to it. Activated T cell kills the tumor. This is the background of immunotherapy.
Oh.
But for the tumor and activated T cell to join, there are multiple antennas like this.
Hmm.
One of it is called PD1, one it is called PDL1, one is called CTLA4, one
Hmm.
is called B37.1. So there are thousands of such antenna. We are trying to hit one antenna or two antennas and finding a molecule. So the most of the immunotherapy molecules are either PD1 or PDL1 blockers. So there
Okay.
are so many antenna, but our
Hmm.
research or our maximum molecules have come from PD1, PDL1. Still, there is a lot of work to be done on the other ones.
Oh my God. Hmm.
This, so basically, on this PD1 and PDL1, which are sitting on the T cell and the tumor cell, we have designed new immunotherapy molecules like pembrolizumab, atezolizumab, nivolumab, durvalumab, etc.
So in short, doctor, just imagine only PD1 and PDL1 are, I can assume that only two antennas. There are so many other antennas. So still there is so much of
There
research
is a
pending
lot
in
of
immunity.
work being done and a lot of work to be done.
My God. So, doctor, in this, doctor, when you are claiming when the T cells get aggressive, they release some kind of chemical. Can we claim it as antibodies kind of a thing?
Uh,
No?
Not really in that
Okay.
sense,
Okay.
uh, but the activated T cells release certain cytokines and which kill the tumor cell.
That's it's something which really fancy to hear that some medicine will make your body to kill the tumor cell.
Correct, correct. And improvises your body rather.
So, doctor, like when you were saying, yes, as you told that chemotherapy comes with some set of side effects, so is the immunotherapy will also come with some set of side effects, though it will vary from patient to patient. Can you little bit give a small brief or a in-depth brief for our understanding that what can be the side effects for immunotherapy, types of side effects?
So when you give the commonest side effect, as I said, is weakness or fatigue.
Hmm.
The next common side effect we see is hypothyroidism. Thyroid levels go down.
Okay.
Another common, so whenever you do immunotherapy, every 3 months do a thyroid test.
Oh,
You may develop hypothyroidism, you may develop hoarse voice, you may develop cold intolerance, you may develop puffiness of the face, you may develop obesity, constipation. Do a thyroid test while on immunotherapy. Some people develop skin lesions, pigmentation, itching, that is dermatitis.
okay.
Every immunotherapy cycle, do your LFT, liver function test. Your
Hmm.
liver enzymes may go up. Pancreatic enzymes may go up, called pancreatitis. Patients may have severe pain in the abdomen. That is because immunotherapy can cause pancreatitis. They can present with diarrhea sometimes because immunotherapy leads to colitis.
Okay.
These are the common, and finally pneumonitis, which is a very fatal side effect, which is breathing difficulty, cough, chest infection type, so chest inflammation. So
Hmm.
immunotherapy can lead to all these kinds of bizarre side effects.
Okay. So, doctor, like it is during immunotherapy, the patient will be hospitalized and also the side effects will be taken care.
Immunotherapy is a 1 hour injection usually. They come, they take the injection and go. But when they develop serious side effects like pneumonitis,
Hmm.
uh, cardiac issues, then you may have to admit them.
Uh, Obviously, handling at home will be very difficult.
It's very
Difficult in
difficult.
breathing, heartbeat gets disturbed.
Yeah. Most of them will respond to steroids, either oral steroids or IV steroids.
Hmm.
Yeah.
Okay. So, doctor, like you are claiming that immunotherapy is given in the hospital. Can you little bit more brief more on how to give exactly immunotherapy?
So immunotherapy is an injection. You mix it in saline and you give it over 1 hour.
Okay.
Immunotherapy doesn't require pre-medication.
Oh,
Pre-medication means before you give chemotherapy to prevent reaction, you give certain medicines. For immunotherapy, we don't give because we are not expecting reactions. It's a daycare procedure. Patients come, take the injection, and they go.
okay.
The next injection is 2 weeks or 3 weeks later, based on the type of immunotherapy.
Hmm.
Sometimes it is given alone, sometimes it is added to chemotherapy, like in lung
Okay.
cancer.
Okay.
Okay, so that is how immunotherapy. So the patient comes early in the morning, they have their blood work done, liver
Hmm.
function test, CBC, the thyroid profile. We check them for immunotherapy related adverse events which happened in the previous cycle. You
Hmm.
give them the drug within 1 hour and you send them home.
Oh, so it is like just one day the immunotherapy can take care of the patient.
Everything, 1 hour, 1 hour or 2 hours.
So then what about chemotherapy? Like how many days the patient has to be during the cycle? What is the process for the chemotherapy?
So chemotherapy depends, right? You have chemotherapies which are given in 5 minutes, chemotherapy which are given in 46 hours also as continuous infusion.
Okay.
So for chemotherapy, they also come the same way, daycare or admission, and they take it.
Hmm.
So basically, all these medications are given intravenously so that it goes into the bloodstream and starts acting.
Hmm.
Broadly,
Obviously.
immunotherapy is a short form of treatment given in the daycare, 1 to 2 hours of treatment, once every 2 or 3 weeks, and given either alone or with chemotherapy.
Okay, doctor, in the combination also you were highlighting some radiation, chemotherapy, immunotherapy. So is there any combination also preferred for the patients
So
to
in lung
treatment?
cancer, in stage 3, for example, after radiation and chemotherapy, we give immunotherapy for 1 year.
Okay.
That's why immunotherapy can be used in stage 4, can be used alone, can be used with chemo, can be used in stage 3, after radiation, after surgery, or sometimes even before surgery.
Oh.
So people slowly move from the stage 4 to the early setting.
Hmm.
But for common public, for common knowledge, most of the immunotherapy even today is used in the advanced cancer.
Oh my God. Doctor, it will be really challenging for you to decide what to do with that patient. Shall we go with chemo? Shall we go with immuno? Shall we go with radiation?
So what happens is our job becomes easy, um, where we do this PD-1 testing, which I told you.
Hmm. Hmm. Hmm.
In some cancers, so you have to do this testing,
Hmm.
PD-1 testing,
Hmm.
PD-L1. If
Hmm.
the score is very high based on each cancer, for example, lung cancer, if the PD-L1 score on the tumor is above 50, you can give
Huh.
immunotherapy alone. In head and neck
Oh,
cancer, if it is above 20, you can give immunotherapy alone.
okay.
In triple negative breast cancer, if it is above 10, you should give immunotherapy. So, um, uh, the decision to use immunotherapy is also guided by PDL1 score on your tumor.
Hmm.
Also on the tumor, we do certain tests called MSI, microsatellite instability, and
Hmm.
TMB, tumor mutation burden.
Hmm.
So if you have high MSI, if you have
Hmm.
high TMB on your tumor, the report comes to you, you
Yes.
can give immunotherapy. Immunotherapy works well. So the common indications of chemotherapy, immunotherapy are high MSI, high TMB, and high PDL1 score. So
Okay.
so these are the common things to guide you to use
Hmm.
immunotherapy.
Oh my God. Actually, sir, the immunotherapy, after listening to this much, whatever information you think, I guess immunotherapy is a very big subject to understand, even
Very
for a
big,
common people, basic.
fastly moving, and very challenging. If you don't read for 1 month, you're out of date.
Oh, okay. Even doctor, if by chance the patient misses one cycle, then for immunotherapy.
And that's fine. So usually one cycle should not cause an if it is a legitimate reason, fair enough. Not that so you always emphasize them to be compliant,
Hmm.
but one cycle should not be a problem.
Oh, oh my God. Still, so many things are there to learn for immunotherapy.
Yeah. What I would like to add in Indian setting is immunotherapy is extremely expensive. Please understand.
Yes,
Our
yes.
patients majority cannot afford. The cycle cost will be 1 to 2 lakhs per cycle. You have to give for a minimum of 6 cycles, and if it is working, then probably you have to give it for up to 2 years also. Imagine how many can afford. The
Very
government has a
difficult.
patient access program in which the
Hmm.
medicine is given at a subsidized cost, but even that is 1 lakh or 2 lakhs, which is out of reach for most patients. This 1
Oh,
lakh or 2 lakh is per cycle, which is almost once a month. So imagine how many can afford 2 lakhs a month.
very difficult.
And till now, at least there are no generics. The
Hmm.
original molecule is only there. So we will need more generics. We'll need cost cutting so that all patients can take the medicine. It is not the only the rich guys can afford immunotherapy and the poor guys who can probably do better with immunotherapy will not do well.
So even doctor, like the government, if the total immunotherapy treatment is taken care, then even the poor people can afford.
Yeah, that is wishful thinking. That is not going to happen.
Yes.
But already government has rolled out many programs where immunotherapy is subsidized like anything.
Okay.
Yeah. So, but it is still expensive. That is what we should tell our patients.
Yes, rightly
Because
said, doctor. Two
all our
lakhs per
patients
month.
should understand. Don't buy one cycle and then say I don't have. Only if
Yes.
you're able to go for 6 to 8 cycles, do go for immunotherapy. If you buy one cycle and then not able to take immunotherapy later, then there is no point in it.
So, doctor, like in the combination you told it cannot be done like two cycle immunotherapy, then shift to chemotherapy, like that is not possible for a
It is
patient.
not standard practice, right? You always follow guidelines, and in the guidelines, are very strict guidelines how you should give immunotherapy. This is not like that.
It's really challenging, doctor, to treat a cancer with immunotherapy in this circumstance, especially with our Indian circumstance, will be
You
very
have to keep your
difficult.
eyes and ears open when you are giving immunotherapy. Even if the patient progresses on the scan, but he looks okay, then it could be pseudo progression.
Mhm.
Look for thyroid, look for pancreas, look for liver each cycle, look for skin toxicity. Hopefully,
Even,
keep the
mm,
cost as low as possible for the patient so that it helps them. A new concept called low dose immunotherapy has come where to reduce the
yes,
cost, one patient's dose is divided for 7 patients. 240 is given to 240 milligram, for example, which should be given to one patient, is given 40 milligram into 6.
okay,
So 6 patients are benefited. And they have also seen that low dose immunotherapy also has good results
okay,
because chemotherapy, the way we calculate the dose and
mm,
immunotherapy dose calculation is different. Even in low doses, immunotherapy works in your body. So you
mm,
need not use a very high dose, they say, like a fixed dose like 240, 200.
mm,
You can use a weight-based dosing. So suppose somebody is only 40 kilos, 40 into 3 is 120 milligram you can use. You don't need 240 milligram.
almost half.
What research has taught us is immunotherapy works efficiently even at low doses. If you give it weight-based, your dose will come down. If your dose comes down, your cost comes down.
Yes.
So in India, we need to reduce cost. We need to make it accessible. Low-dose immunotherapy is the way forward. For low-dose immunotherapy with combination chemotherapy is the way forward. And be mindful of the side effects of immunotherapy.
So, like in this low dose immunotherapy, I just, if I don't know whether I'm right or even the side effects will be coming down.
Right. Side effects are not much in immunotherapy, but still the side effects would come.
Yes. Oh my God, doctor. Immunotherapy seems to be a very good choice for treatment, but looking into the cost, I guess it's a little bit challenging for the patient to afford.
I think generics are going to come in a year or so, 6 months or so, then there'll be game changers. They will reduce the cost significantly.
Touch wood, sir. Anyhow, doctor, in the market, many products have the generics available. I hopefully immunotherapy should also be 6 months. Still, it's a huge time because so many patients are there in this below
Yeah,
6 months. And also, some help from government will really help us a lot.
they're already doing it. Yeah.
Wow, doctor. Thank you, doctor. Actually, immunotherapy is such an interesting topic. We have just crossed our time limit. And I can still assure there are too much to know about immunotherapy for us like a common people for us. Obviously, from such an expertise like you telling us a basic about immunotherapy will obviously help a patient to go for a better treatment or a better choice of treatment. So, thank you, doctor. By this, we came to an end. Doctor, would you like to give some closing message on this Cancer Immunotherapy Awareness Month?
So immunotherapy is the latest kid on the block. Let
Yes.
us all understand that. We are slowly moving away from chemotherapy to immunotherapy in many cancers like head and neck, lung, breast,
Mm,
uh, kidney, skin,
mm.
and other cancers. It doesn't have side effects like conventional chemo. It has its own set of side effects. It is given IV route in 1 2 hours. Extremely expensive, but people are trying to reduce the cost. And the one good thing of immunotherapy, which I had to mention, was if you get a response on immunotherapy, right? The
Mm.
responses are durable, they are long term. If it doesn't work, it doesn't work. If it works, you will do extremely well. So I think
Oh,
this should be the take home.
wow. So in short, doctor, the life of the patient with chemotherapy, immunotherapy gives more.
That is not like that. In those set of patients whom it works,
Hmm.
we have some patients in whom it works beautifully. Even if you
Okay.
stop the medicine after 1.5 2 years, it is more than 1 2 years now. They are disease free.
Wow.
So
Okay.
his body is an immune rich environment where the immunotherapy has worked beautifully well. So that's the final thing I would want to say. In the responses are low, 20 30%, that's it. But in whom it works, the responses are long term.
Wow. Actually, doctor, frankly speaking, with the depth of my heart, I'm like, why I am stopping the immunotherapy session? It is so interesting. The time is forcing me to.
We'll
But
have
hope.
another session next week. We'll continue this same thing next week.
Thank you, doctor. I will be desperately waiting for that session because such an interesting topic. So many hopes on cancer treatment has, I guess, it has given for the other people listening to this session. No doubt, doctor, next session, even I, along with me, many of the audience will be awaiting desperately to know more about or to learn more about immunotherapy cancer. But till that time, thank you very much, everybody. So, wishing you a good health, good hope, and also good strength. And also, please make sure that you stay away from cancer. So, good health from Cancer Reach. Thank you, everybody. Thank you,
Thank
doctor. Thank you very much.